Every day, 43 children are diagnosed with cancer, and 12% do not survive. Their average age is 6.
50% of children who survive cancer experience later effects such as infertility, heart disease, and secondary cancers.
Childhood cancer occurs regularly, randomly, and affects no particular socioeconomic group, class, or geographic region.
My name is Jerry Chadwick, and I am president of the Children's Cancer Foundation. I joined the board over 20 years ago, and the mission of the Children's Cancer Foundation is as important to me today as it was when I first joined the foundation. Until recent years, our grant dollars were focused on facilities, as we funded the pediatric oncology units at all of the major hospitals that we support. However, in recent years, as those facilities were completed, we have now shifted those priorities to funding research, a cure for cancer.
So I was in my 3rd year at Virginia Tech. It was the fall semester, and it was about a week before Thanksgiving break. The first moment I started experiencing some just terrible back pain. It was almost like a knife. And then that Thursday is finally when I got an MRI. And then the MRI revealed a mass on my spine. There's no way to describe when you're in a situation where you know that a medical practitioner is a little bit scared of the situation that you're in. And I just kind of had this feeling where I was like, I can't wait any longer. Like, I need to get into surgery. I need to get this thing out of me. And I came out and it was out. I mean, the surgery was very successful. About 3 days, the 3rd day at the hospital, we figured out and got a call from the neurosurgeon that the first pathology report came back that it was malignant. My sister specifically found Dr. Turetsky, that was with Georgetown, and just gave me his name, and I literally just Googled him and found his phone number and called him and just said, "Hi, I have Ewing sarcoma and I would love to talk to you about my situation." And so it just took a phone call. I mean, it was probably the most important phone call of my life.
I was working at my desk and the phone rang and I picked it up, and this very, very sweet and lovely voice said, "I have Ewing sarcoma, and I'm wanting to learn more about it." The reality, and it's even a sad reality, is that the therapy for Ewing sarcoma has been pretty constant since the late 1980s. Despite the fact that we know more and more about the molecular underpinnings, the driving genes of Ewing sarcoma, it's taken us this long to actually get a drug in the clinic that directly addresses these things. And I think that that story holds true for a lot of different cancers.
After talking to Dr. Turetsky, he recommended that I go the pediatric route. It was going to be an 8 to 9 month process of just fighting this thing and making it go away because it was still in me. The chance of relapse is so high, even though the tumor was resected, the cells in my spine, it takes 1 cell.
So we're really a unique lab in that what we do is translate cell therapies from the bench into the clinic. And so if you're going to treat patients with these novel cell therapies, they have to be made in an area where you feel safe, where you can make these cells without risk of contamination, without risk of hurting the patient even further. So we'll take those ideas, those new discoveries, we'll translate them into our lab for a phase 1 clinical trial. And then if that's successful, what we'll do is we'll try and move that into a phase 2, into a phase 3, and eventually for licensure. So we could potentially make a new drug. So you can imagine the disappointment we had when the FDA came back to us and said, you know what, you have to do a couple more validation runs before we take you off of hold to start enrolling patients for your clinical trial. So what the funds from the Children's Cancer Foundation did was enable us to finally overcome that last hurdle, to do those last few experiments and say to the FDA, you know what, here we're able to make these cells, they're safe, and we're ready to go and test these in patients.
So the hardest part, we thought, when Cade got diagnosed with cancer was the day we found out. Our lives were crushed. As a parent, you can't imagine anything worse than that day. And then just a few days after that, he underwent a 9-hour brain surgery, which was the hardest day of our lives. We paced the halls, we prayed, our family was there. We just worried, obviously. Didn't think lives could get worse than that day. And then his treatment started. Just seeing the side effects of treatment has been awful. He's lost his hair, he's thrown up more times than I ever have in my life. His eyes are always dark, sunken in, he's pale, just so skinny. It's just awful to see the side effects of the chemotherapy. So we are very grateful to foundations and programs such as CCF, because without that, we would not have the money to fund the clinical trials like my son is participating in. And I know how important they are for other kids, because without them and without the research behind that, it wouldn't go anywhere. So we need that research so that the doctors can discover more cures and more treatments with less side effects. Because the side effects are way worse than anyone could ever tell you. Until you experience it, they're pretty bad.
So I was just in for a checkup with my oncologist, Dr. Kim, and she had just mentioned that after meeting with this tumor board, they decided that proton beam radiation was the best situation for my specific tumor on my spine.
The important thing is how can we best treat this and provide a limited amount of late effects as much as possible. And because we are part of this multidisciplinary clinic and we work with Dr. Kwok at University of Maryland for many of our patients, we thought that this proton beam approach would be best for her.
Most pediatric patient population, they recover, they get cured, and they live into adulthood. And many of the older patients who were treated with regular radiation start to develop cardiac problems, and we're very excited that the proton beam therapy can decrease that risk as much as possible. Since some of these plans, the cardiac dose is virtually zero. So in the case of Eileen, her heart dose from radiation was virtually zero with proton beam therapy.
Early C funding remains and will always remain a critical aspect of people getting new discoveries developed.
It's really not so much the cancer, it's the chemotherapy. I really just want there to be better medications out there, especially geared towards children, because I don't think there are enough.
The funding from the Children's Cancer Foundation provides us the much needed bridge funding or seed funding that not only is the seed funding that allows us to initiate these projects, but it really enables us to keep going.
I don't think there's enough that I could possibly do, so I would implore others to begin to look up the Children's Cancer Foundation, support our research programs, because we need your help.
So I am more than excited to finally be able to see that big and bright light that is at the end of this long tunnel that I've gone down and return to this reality that I've been holding on to for 9 months. And I've been wearing this cancer bracelet that says what cancer cannot do for 9 months, and I have another one that's sitting on my dresser waiting for me to wear that says survivor.